to order. We have no public comment, I presume.
No.
I reviewed the minutes from our previous meeting and everything looked okay to me. So unless there are any concerns about the minutes, I'd like to ask a motion to accept the minutes.
I'll make a motion that we
All right,
accept.
all in favor?
Aye.
Aye.
Anybody opposed? Okay. So the minutes can be approved. I saw there was an inspection report that was submitted ahead of time. I had a couple questions about it. Maybe somebody knows the answer to. It said 34 laundry inspections. This report in Hanson. Well, what is Hanson? I don't know what that
That's what I
meant.
was gonna ask too.
Hanson is our computer database that we use for all
Oh.
of our property and ownership information on all of the
Okay.
city properties.
All right. Okay. The other thing I was curious about is they had made a point that they were having difficulties as health inspectors because a lot of the businesses were changing hands. And I was just curious whether that was a frequent occurrence or something new to have to do with COVID, or why now? Or is this just always an issue?
I can't answer that, but I can send an email tomorrow and
Yeah, I was
get
just
that
curious.
answer for you.
And then the other question I had is at the very bottom, they said the mask wearing continues to be a problem, but mostly among customers. And I believe that. And I don't know whether Mr. Latchett would know this. I mean, if you're a entrepreneur and you own a business, even if there isn't a definite mandate that you have to wear masks, as a proprietor or an owner, can you make that rule? And, if you don't want to abide by it, then you don't come in?
Yeah, I mean, it's basically like no shirt, no shoes, no service.
That's good.
But you can't, it wouldn't be enforced like any disorderly conduct or trespassing, maybe. I don't know what the exact, but it would be just like any other disturbance in a private setting, but a public place, but that's owned by a private establishment, such as a supermarket or anything like that.
All right. That's kind of what I figured. Corona virus update. Is Jeremy or somebody here for that, or
I don't think so.
not at the moment? Okay, well, if he joins.
Mike Sninsky can speak on that.
Oh, okay.
Yes. How's everyone doing today?
You're doing all right. Welcome, Mike.
Good. Pretty much where we're at in the general population since March. We're looking across the zip codes, and again, this is all pretty much on the Pennsylvania Department of Health website, and the good doctor can pretty much corroborate this too. We're looking at a 4 to 7% increase across the zip codes that encompass the city of Reading. Our department, the city Reading Fire Department, we're still keeping all our restriction norms that in place to ensure the protection of our staff. We're sitting at about 70% vaccination status. There's a couple people that are trying to get vaccines or on lists to get vaccines that had COVID. Part of it comes down to, I guess, the process of getting that. They're on the waiting list for different places to actually get that vaccine. It's been a slow process in getting one. I know there was also some talk in the city, and Mr. Latchett could probably elaborate more on this. I know there's a plan to get some vaccination sites up and running throughout the city. The department ourselves, we have about 10 paramedics, which is about half of our paramedic staff is cross-trained. We're just waiting to get the go-ahead to be pressed in the service to help vaccinate people when that time comes, when when all that comes into play. Other than that, we've been fortunate where we are as a department, for lack of better terms.
Are there any or many new cases popping up among your staff, your personnel?
No, thank goodness. We had one, I think, in the end of January, as an actual personnel that was in that worked in the actual field, And that person, it was kind of a weird case because that person actually had had their first vaccination and they were like waiting for their second one,
Ooh,
and they didn't have serious symptoms. It was kind of like they had like mild, they're like, you
Mhm.
know, kind of like the head stuffiness, you know, almost like a sinus infection kind of thing. They were only felt sick for a couple days and it really wasn't even that severe. But because we had that weekly testing, we were able to get that taken care of and remove them from our population and get them out so that anyone else wasn't come in contact with them.
Now, the people who have not been vaccinated, is that mostly just because they haven't had the availability yet? Or do you have issues where some people don't want to be vaccinated?
A majority of them is they're waiting, but there are a couple that aren't
Right.
interested, and there is that fear among some people. I mean, I personally have encouraged everybody I can, and we
Sure.
try to get as much information out there to as many people as we humanly possibly can to get vaccinated.
Right.
But, and also there is something that's brewing in the state legislature, House Bill 262 that was introduced in mid-January, that it hasn't been passed into law, but it basically is to prohibit employers from making it mandatory to test or vaccinate. So that's also on the horizon too.
Right.
And I mean, and again, Mr. Latchik can probably talk more about that, you know, so that also becomes a little bit of a, you know, a little bit of a minefield to deal with too at some point.
Dr. Kelleher, maybe I'm a little confused about how this is rolling out in a way, and I know you're more involved. You know, initially it was going to just be, 70 and over, and then it was going to be, they're going to go 1A, 1B, 1C, and then suddenly they open it for everybody 65. And now recently I've been hearing a lot of people, somehow younger people, getting in. And I've heard rumors that, within another 2 weeks, they'll lower the age limit. But it disturbs me that they're doing that if there are people who are still 65 and above who haven't been able to get it, or even worse, first responders who haven't had it available to them. So any comment on that, Dr. Kelleher?
There's lots of discussion. So the State Department did set out guidelines of vaccine rollout and who was eligible. So it started first with healthcare responders and those 65 and older, and wait lists were 10,000, 12,000 people long. They then expanded it to people less than 65 who had certain high-risk conditions. Believe it or not, firemen were not considered a 1A priority group. So they technically just got opened up to be vaccinated on April 4th. And many who had been vaccinated either fit that high-risk 1A category or went outside the county to get vaccinated. And there were some people who, quote unquote, weren't following those guidelines. I think even today on the national news, Biden announced that he's opening it to the whole age demographics of people 16 and older on April 19th, which is where the state has set their deadline to open it up to everybody. So we're technically still in 1B, which is the original 1A group. And then 1B is a whole list of employee-based definitions like firemen, like police, like correction officers, grocery store workers. And then 1C is supposed to be next week. And then April 19th is everybody and anybody. So some were not following those guidelines, and some were finding that they were more receptive to going outside the guidelines outside the county. So a lot of people got vaccinated outside the county, including a lot of first responders who.
Yeah, Michelle, what were you going to say?
Yeah, I'm part of 1C, but I'm just curious, if it took us this many months to get through 1A, how are we going to do B and C in a week before we open it up to everyone? Like, kind of, what's the point of that if we're going to just be waitlisted?
Somewhat, I don't know what the word is to describe my response. I think that what the state is trying to do is to be able to say to people, we did give you priority, even if it's for a week, but reality is that it's not real. So they had always promised that they would roll it up. So now they can say, okay, we gave the 1B priority, we gave the 1C priority. But it's really realistically not going to really have an impact, because exactly your point, there are still 65 and older who have not been vaccinated, though a large percentage of Berks County 65 and older have had, and that's why the death and hospitalizations has gone down, even if the cases haven't. But there's hope that there's going to be a lot more vaccine in the area, and a lot more people able to distribute those vaccines. I think most of it's going to go to the pharmacies and the retail pharmacies, but there's going to be a long time before everybody has access to the vaccine, unfortunately.
Dr. Kelleher, you had mentioned about people going out of the county. Do different counties have different rules, or they just,
No,
how
I
does
think-
that help them?
I think they were a little bit more lenient with their rules. So, you know, the person who was talking on behalf of the fire department could probably say that a lot of his colleagues probably did go outside Berks County, because
Right.
that's what we were hearing, that Lehigh Valley doing those massive 3,000 a day vaccine clinics where more teachers got vaccinated on some of those events before it was opened up to them. So there were definitely people, quote unquote, jumping the line. But really, you know, the push is to vaccinate as many people as possible. So some of those
Right.
vaccine providers were just vaccinating those who were in front of them and not really asking as many questions as maybe they could have.